With some surgeries, it's oftentimes a good idea, if you can, to add in a second procedure if you want to, because you can really recover from both surgeries at the same time, and it is more affordable, one anesthetic, and oftentimes the same or just a little bit extra downtime. So one of the most common procedures I do is top surgery for folks assigned female at birth, and a lot of those patients, probably about 30%, will add on another procedure. So let's run down through the top 5 procedures that people add on when they're doing top surgery. Top surgery takes an hour and a half typically, so it doesn't take too much out of you. So that's an ideal one to add in something extra if you plan to do that. By far the most common procedure we'll see folks adding on is good old torso masculinization. I've done a lot of videos on this, and this is where oftentimes at the same time as top surgery, we'll just go in and eradicate unwanted curves. Usually we're doing this with liposuction, and it goes hand in hand very well with top surgery because you just recover from the two at the same time, and most patients don't find it adds too much to their recovery. The second most common add-on we'll do at the same time as top surgery is what I call masculoplasty plus. And so basically what that is in certain folks, depending on their anatomy, if they have folds in the upper belly, we can get rid of those folds at the same time as doing the top surgery without any extra incisions. This works really well for folks who have lost a lot of weight. I have a lot of pictures of this. And it doesn't tend to add too much downtime to the recovery. Number 3 most common procedure we add on is liposuction under the chin. So in the right patient, and it tends to work better on young patients who don't have loose skin there already, we can go in through 1 or 2 little incisions hidden underneath the chin, tiny little incisions while the patient is asleep, and get rid of fat in there as well. This can be a game changer for your profile, getting rid of that double chin. Typically we have the patient wear a strap night and day around their head in order to help the skin shrink in and prevent swelling, and they just wear that when they're off recovering from their top surgery. The 4th most common add-on we see folks do is an abdominoplasty or a tummy tuck at the same time as top surgery. And this is typically in folks who have maybe delivered a baby and have some loose tissue there, or much more commonly now, we're seeing this in folks who've lost a lot of weight. In an ideal world, if a patient plans to lose weight, you should do that before top surgery. I understand it's not always possible, and for that reason we don't have a BMI cutoff. But in patients who go ahead and lose the weight and have loose skin there, we can definitely add in a tummy tuck at the same time as doing regular top surgery. And number 5 is an arm lift at the same time as top surgery. And again, this is related to why we're seeing abdominoplasty done a lot more commonly. Folks are succeeding in losing weight. I think a lot of it is really down to the new medications such as Ozempic or Wegovy. So we are seeing folks who are successfully able to lose weight before their top surgery and then have loose skin that bothers them. So while they're asleep, while we're doing the top surgery, we can also do an arm lift and get rid of any bat wings or loose skin up there at the same time. And it really doesn't add much to recovery. And number 5 is an arm lift at the same time as top surgery. And again, this is related to why we're seeing abdominoplasty done a lot more commonly. Folks are succeeding in losing weight. I think a lot of it is really down to the new medications such as Ozempic or Wegovy. So we are seeing folks who are successfully able to lose weight before their top surgery and then have loose skin that bothers them. So while they're asleep, while we're doing the top surgery, we can also do an arm lift and get rid of any bat wings or loose skin up there at the same time. And it really doesn't add much to recovery.